And so there are many patients that discontinue extended endocrine therapy for all sorts of reasons. It might be side effects, but it could just be, time has gone by and you've been taking this pill, once a day for 5 years, and it's difficult to know whether something is helping because it's helping if you don't develop the recurrence. But along the way, it's hard to tell whether you really need it or not. And so that is one reason why patients discontinue. So it's important to get our patients on board if we have made that recommendation to continue with endocrine therapy for another 5 years. And so in that same study that I had referred to earlier that was published in March with the surveys pre and post BCI, 82% of patients surveyed said that if they were recommended extended endocrine therapy, they are more likely to be compliant based on the BCI results. And that makes sense, right? It takes that, I'm not sure if it's helping, to, oh, it's definitely helping. And so they're more likely to not only just say they will sign up for extended endocrine therapy, but actually continue with it for years, 6, 7, 8, 9, and 10, which can be hard to do. All right, so in this case, we have a patient who's 63 years old at the time of diagnosis. Katie knows her well.
Yeah.
Node negative. We'll discuss why in a bit. Her tumor size, medium tumor size, 2.5 centimeters, but grade 3, estrogen and progesterone receptor positive, HER2 negative, Ki67, 22%, and that oncotype recurrence score of 48, right? That is high. When we kind of set our cutoff at 26, 48, high. We recommended chemotherapy. She took one cycle and it didn't even end up in the hospital. Wasn't like that, but just decided she did not want any more. So we did not give her any additional chemotherapy, but she was willing to start endocrine therapy. And so she has been on anastrozole. She developed osteoporosis. And after some initial resistance to taking bone-directed therapy, she ultimately started therapy with Boniva, and she remains on anastrozole and ivandronate. And we ordered BCI 4.5 years after diagnosis. And these were our results. So predictive, yes, she was likely to benefit from extended endocrine therapy. She stopped at 5 years, about a 14% risk of stage 4 metastatic disease. But if she continued for another 5 years, that is reduced to 5%. And when she saw these results, she was on board. She was completely on board. She saw these numbers and they made sense to her. And while one might think, because of how she started her breast cancer treatment journey, that she might be less likely to comply with recommendations, when she saw this, she wanted to continue. And at her follow-up visits, she still feels the same way.
Yeah, when you told me this, I was shocked. She gave me palpitations. Okay, I tried so hard to get her to do chemotherapy. I know you did too. You met with her multiple times, and I did. And when she decided to stop, I was unreasonably crushed. So I was really shocked when you told me that she decided to continue. I think that's wonderful.
Yeah, absolutely. She's, she made it this far, and I think she also recognizes in the back of her head that she had made the decision not to take chemotherapy, although we discussed that influences the first 5 years more, but seeing this, she was just, 100% on board.
Yeah, I think she really trusts you. I think over time, she's just built that trust in like what we
Takes
do.
time.
And that has helped. Yeah.
Right. It does take time. And it also takes, we'll talk about this in a bit, planting the seeds, like knowing what's coming next. Sometimes in the beginning of treatment, everything's happening so quickly. The recommendation for surgery and then for chemotherapy and all of this. But in our decisions about extending endocrine therapy, we have more time over which to develop a relationship and introduce these concepts